So now you've taken out the 2 syringes after it's been spun in the centrifuge. What do? Once you've taken it out, you'll find a layer of oil on the top. Pour them straight out into your waste kidney dish. And then the second thing you do is to tighten the little screw. Remember, we loosened it a couple of turns as we put it into the centrifuge, as we talked about before. So tighten the screw back, only hand tight, and then put your screwdriver down. Now you've just poured the oil out. Now it's time to expel the tumescence and the blood. So to do that, we grab the push stick and the push stick locking plate. Push that in 90 degrees, just like you did with the Tara lock. Turn it till it locks. Okay. Now grab your push stick and it just screws on. Just gently screw it on until you see the end of it touch the piston. So as soon as it touches the piston, stop. Then undo your green cap, put it over your waste dish and turn the push stick. So every full turn of the push stick expels approximately 1 ml. So if you push it all the way down until you've expelled all of the blood and the tumescence, until you see a little bit of fat come out, that's the time to stop. So let's assume we've done that. So now you're left with the pure fat in the syringe. Okay, so put the green cap back on this one. Now remember, we've got 2 syringes to do. So unlock the locking plate and just pull it out, this one. Now put this down, grab your next one, do the same thing. 90 degrees, push it in, lock it tight. After you've locked it tight, undo the green cap. And then same thing, over your waste dish, just push it out until you've expelled all of the blood and the tumescence. Okay? Then turn it back up, undo it 90 degrees, take off your push stick, put your green cap back on. Okay, so you now have an amount in each syringe of the actual fat left. And that's why we call this the 24K fat, because this is the pure fat that's left. And so you can then let the surgeon know roughly how much fat remains. All right, so now what you want to do is transfer that fat into 10 ml syringes, normal standard 10 ml BD syringes, so that you can then put it through the ADINIZER or the fat micronizer, which we will talk about a little bit later. So the first thing to do is to undo the green cap. Now take the syringe to lure lock adapter, which is this one here. Okay, and then put the large end obviously onto the syringe itself. And then the other end fits into, grab a brand new 10 ml syringe, just loosen the plunger, attach it. Okay, so now you're ready to push the fat out. Grab your push stick and undo the plate. Put the locking plate back in 90 degrees until it locks again. Now it's locked. You put your push stick back in, screw it down until it touches the piston. Okay, and now every turn expels about 1 ml. So you can see it's very safe and very controlled. So you can see this other end. So this is now getting filled up with fat. Okay, so you can do it very gently until you've reached 10 mils. Then hold this adapter, take your first fat-filled BD syringe off, put another empty one on. Okay, and then continue turning the push stick until you've filled and expelled all of the fat. Now, that may be 2 syringes, maybe 2.5. So just do that until it's all gone. And you will find that right at the end, there's always going to be a little bit left because of the piston. So there's always a tiny little gap. It's a tiny little bit. You won't be able to get that out once you've hit the end. Okay, so that's it. There should be a tiny little bit left. So then you just take the adapter off and do the same thing again with your second syringe. Same process. Undo 90 degrees, put that in, lock it in. Okay, till it touches the piston, undo the cap, put your lure lock adapter on. Okay, and then just fill more 10 ml syringes. Okay, and that is how you transfer the fat out. Okay, so once they are all now in your 10 ml syringes, you are then ready to adinize or micronize the fat, and we'll talk about how to do that next.